So obviously what we're going to talk about today is some of the basic principles behind cardiac MRI imaging. So obviously, I think all of you, who's not seen an MRI scanner before? Anybody here has not seen one? So you know it's this little donut type machine. The patient lays down on the table here, the table goes up, and the patient goes into the bore of the scanner. So you know, what we can produce with this is really images that allow us to see a variety of different pathologies. And you can use it for a variety of different applications. And throughout this year, in this conference, we'll go through the role of MRI in cardiac masses, in perfusion, in valve assessment. But what I want to talk today about is really just the basics of how is it that MRI works. So the first question, I guess, is who are these two guys? These two old guys? So these are kind of the founders of the field of MRI. Peter Mansfield on the left-hand side and Paul Lauterberg on the right-hand side. These are both PhDs. And they, in fact, won the Nobel Prize in Physiology and Medicine in 2003 for their discoveries concerning magnetic resonance imaging. And most of their discoveries were made in the 1970s. So it gives you an idea of from kind of initial conception to where the field has evolved over these years. So here's a question. When was the first MRI exam performed in a human subject? Not an animal, but in a human subject. 1969, 1980, or 1977? Who wants to take a guess? Okay, raise your hand if you think it's 77. Okay, who thinks 1980? Who thinks 1969? Nobody. Okay, so, and actually most of you are right. It's 1977 is when the first human exams were done. And do you know how long it took to image the finger? About 5 hours. So you can see we've made significant advances since the early days. Now here's another question. For common modern clinical MRI imaging, what's the most important element? Is it in the human body? Is it oxygen, hydrogen, or carbon? How many think it's oxygen? Raise your hand. Okay, how many think hydrogen? How many think carbon? Okay. You're the one man. Why do you think it's carbon? You're just a counter. You just want to go against the flow? Okay. So actually, in this case, also the vast majority of the folks are right. It is hydrogen. You can do imaging with carbon. You can do imaging with a variety of different atoms or molecules. But hydrogen is the one that we do for clinical use. And the reason for it is because the human body is made up almost 2/3 of water, which is hydrogen. So that gives you the most robust signal. And if we really talk about what is it that MRI is doing, or what does it entail, it's really two things. It's a magnetic field, a magnet, and it's radio frequency waves. And that's really in the most basic sense. It's these two things that we're then manipulating to be able to actually generate an image for us. Now, so I said, obviously we know about the magnet. And I also talked about the radio frequency waves. So what's the purpose of these radio frequency waves that we use in an MRI system? Is it to change the shape of the nuclei, to change the spin of the atom's nuclei, or to change the composition of molecules? So how many thinks it's to change the shape of the nuclei? Okay, how many thinks it's to change the spin of the atom's nuclei? And how many thinks it's change the composition? Okay, so most of you, I think, are right here. A few of you, though, are falling asleep. The postprandial nap time, I guess. So you're right. That's exactly right. That's what we use, is to basically change the spin of the atom's nuclei. Okay? And so let me just talk about some of the language that we utilize. So obviously we've got what we call the main magnet coils, and that's within the body of the scanner itself. But there's also what we call gradient coils, and the purpose of these are to cause a local perturbation or alteration in the magnetic field. And then obviously the radio frequency transmitter coil, which sends in radio frequency waves, and then there's a radio frequency receiver coil, which actually receives the wave. So it's just like a radio station back in the days of AM and FM, where the transmitter would transmit the RF radio frequency waves, and then a receiver would actually receive the waves. So the main magnet is obviously a very strong magnetic field, and that's what really defines the strength of the MRI system. So we refer to that as B naught. So B with a subscript 0, that's the main magnetic field. Now, in most, well, so let's just give you an idea of what kind of field strength that we refer to. So we'll talk about magnet strengths on the order of Tesla, right? So what exactly is a Tesla? And it's not the car that we're talking about. It's the strength of a magnetic field. And so 1 Tesla actually is equivalent to about 20,000 times the Earth's magnetic field. Now, we all know that the Earth has a magnetic field, right? And so 1 Tesla is about 20,000 times that. So what are the typical field strengths that we use in clinical MRI imaging? Is it 1 Tesla? Is it half a Tesla? Is it 2 Tesla? Come on, you guys. 1.5 is 1, and 3, right? Those are the 2 main ones that are used right now. So that would really correspond to, if we think of also a Tesla as 1,000 Gauss, 1 Tesla meaning 1,000, or 10,000 Gauss, then what we're really dealing with is a field strength of between 15,000 and 30,000 Gauss for clinical MRI imaging. That's 1.5 or 3 Tesla imaging. Now, there are current scanners that are available, just recently approved, that's a 7 Tesla MRI scanner for clinical use. It's not for cardiac yet. Most of the applications for that right now are being developed are for brain and body. But as with anything, the applications start outside of the heart and then slowly make its way to the heart. And in fact, we'll have a 7 Tesla scanner being installed in our research facility probably sometime next year through a research collaboration that we have with Siemens. Okay, so let's get past this here in the interest of time. There's a couple other things that I think are important to be aware of, and that's in addition to the magnetic field, the strength of the magnet, which again we talked about is 1.5 or 3 Tesla, there's the strength of the gradient coils. And we'll go through how or what the purpose of these gradient coils are, which again is to basically cause an alteration in the magnetic field. But the gradient coils also have a strength assigned to them, and that's basically referred to as the steepness in the slope of the alteration of the magnetic field that it's able to achieve. And so the scale that we're talking about for gradients is on the order of about 40 to 50 millitesla per meter of an alteration. So we're talking about a 1.5 or 3 Tesla static magnetic field with gradients causing slight alterations to that magnetic field. And then obviously the radio frequency coils, there's a transmit coils which send the impulse into the patient, and those in most cases are actually within the bore of the scanner itself. But there are some specialized coils that are peripheral coils that could actually transmit radio frequency waves. And then the receiver coils to receive the signal, there's actually receiver coils that are within the bore of the scanner itself called the body coil. But then notice the further away you are, though, the weaker the signal is. Just like a radio, if you have, the further away you are from where the signal is being transmitted, the worse the signal you get. And so in this case, what happens is as signal is transmitted, it goes into the body, is absorbed by the body, and then the body then emits a signal, and we have these receiver coils that we place very close to the area of interest, and that receiver coil then receives the image or receives the waves to then generate the MRI image. Now, let me skip past this here. So again, we talked about the fact that most of what we do is with hydrogen, but in fact we can do carbon, sodium, or phosphorus-based imaging as well. Advantages obviously is that there's a lot of hydrogen in water as well as a lot of hydrogen in fat itself. So the other thing I think it's important to keep in mind is that all of these hydrogen atoms will tend to spin around in a random fashion. But when they get put into a magnetic field, then the magnetic field causes them to align in the direction of the magnetic field, so that there's a net magnetization in the direction of the magnetic field. It doesn't mean that all protons are lined up upright, but it just means that there's more protons lined upright than there are lined in the opposite direction, and so as a result, it leads to a net overall positive or negative magnetization. Now, in addition to this, the frequency at which the protons spin around at is actually a defined frequency. And that frequency is defined by an equation here called the Larmor equation, which basically says that the frequency that the protons spin at is equal to a constant, which is a Gauss-magnetic ratio. Now, this depends for the type of nuclei you're dealing with, which for hydrogen atoms, it's 42 millitesla per meter, or 42 millihertz per Tesla, I mean, multiplied by the strength of the local magnetic field. So if I have a 1.5 Tesla scanner, 42 times 1.5 is going to give you a field, or is going to give you a precession frequency of about 64 megahertz. Now, if you have a 3 Tesla scanner, then the protons are going to be spinning twice as fast at 128 megahertz. And whenever we apply a gradient, so when you put a patient into the magnetic field, when you put them into a magnet, then you cause a slight alteration, or you cause a magnetization to occur, so that these protons now spin around at 64 megahertz if it's a 1.5 Tesla scanner, or 128 megahertz if it's a 3T scanner. And then obviously you can do the math. If it's a 7T scanner, they're going to be spinning around even faster. Now, let's skip past this here, since in the interest of time. The other important thing to keep in mind is that what we can do is, when we send in a radio frequency pulse, remember I said that there's the magnetic field, and the RF pulses, and radio frequency energy basically is transmitted in and is absorbed by the hydrogen nuclei, and as it's absorbed, it causes the nuclei to go from the upright state to a transverse state. So it's a higher energy state that it goes to as it absorbs this energy. So basically what we're sending in is a radio frequency excitation pulse, which then flips the magnetization, and you could do a full 90-degree flip, in which case you take the protons from spinning in the upright direction to spinning in the horizontal or the transverse plane, or you could do a less than 90-degree, in which case you'll get some of your magnetization goes into the transverse plane, but some of the magnetization is retained within what we call the longitudinal plane, or the z-axis. And again, the strength of the radio frequency pulse that you send in determines the magnitude of the flip that occurs. And so that's why this is typically referred to, the strength of the RF pulse is referred to as the flip angle. It's the amount of radio frequency energy that you get to cause a certain degree in tipping of the protons. So 90-degree flip would tip the magnetization all the way to the transverse plane. A 20-degree flip, on the other hand, would only tip it partially into the transverse plane. Now, what happens then as a result is that over time, that magnetization is going to try to regrow back into the longitudinal plane. And actually, before I talk about that, this is just going and showing you, if you do a full 90-degree flip, you basically have zero longitudinal magnetization, but all of your magnetization now has been tipped over into the horizontal or the transverse plane. And then that gives you obviously the largest signal, because the signal that you receive is based on the amount of magnetization that gets into the transverse or horizontal plane. Now, this is actually just a schematic. Oops, let's see if this plays. Yeah, okay, it's not going to play, so that's okay. So let's go back now, and we'll talk about the other aspect, which is MR relaxation. So once you tip the magnetization down, what's going to happen is you're going to get relaxation that's going to occur. So, and it occurs in two directions, okay? One is within the longitudinal plane, you regrow the magnetization to go back up to the steady state. But in addition to that, you lose your magnetization in the horizontal or the transverse plane. And let's go back here. And so this is an example of what would happen in the if I do a 90-degree tip. To start with, I have all of my magnetization in the transverse plane, but zero magnetization now in the longitudinal plane. And over time, that longitudinal plane will relax or recover again and go back to the upright state. So these protons are going from horizontal back into the vertical position. And as it does that, that's what we refer to as our T1 recovery. And the T1 time, and I think all of you have heard of T1 time, the T1 time is the amount of time that it takes to regain 63% of your initial magnetization after you tip it into the horizontal plane. And then, so what's the significance of that? Well, that actually is tissue specific. So certain tissues have a faster rate of T1 recovery than other tissues. So for example, water has a very slow rate of T1 recovery, so it takes a long time for water to regain its magnetization once it's been tipped down, whereas something like fat has very fast T1 recovery and therefore has a very short time or short T1 time. So we can actually use these principles to try to identify the characteristics of tissue, right? And that's one of the big strengths of MRI imaging, is the ability to do tissue characterization based on the fact there's differential properties between different tissues. Now, the other aspect I think that's important to keep in mind, and I'm going to gloss over some of this in the interest of time, is the idea that as you tip things down into your horizontal plane, these protons are constantly spinning around, whether they're spinning around in the upright plane or they're spinning around in the horizontal or transverse plane. What also tends to happen is that there's actually a loss of coherence over time. And the best way you can think of it, the analogy you can think of is if you're at a racetrack and you're at the Indy 500 and all the cars are lined up all at the starting line and they're all running around the track. And in the beginning, they're all fairly close together. But as time goes on, they start to spread out because some are faster and some are slower. And as a result, if you wait a little while, all the cars may be spread all the way out all across your 360-degree circumference. And as a result, there'll be no net magnetization because it all cancels out. So in the horizontal plane, what happens is there's a gradual and progressive reduction in the net magnetization that occurs from the time that you tip your magnetization to the horizontal plane. And the reason for that, again, is due to an interaction that occurs that's referred to as T2 relaxation. Now, T2 relaxation, again, the T2 time is defined as the amount of time that it takes to decay to 37% of the original magnetization that you had in the transverse plane. And again, this is showing you a nice schematic of what happens. You tip the protons into the transverse plane. Initially, they're all spinning around together, but then slowly they start to go out of phase with each other to the point at which they're all completely equally distributed so that there's zero net magnetization vector. And this is the T2 decay time. Now, T2 also is tissue specific. And certain tissue, such as fat, will have a faster T1 decay, T2 decay, or versus something like water, which has very slow T2 decay. And so again, we can use these differences in tissue properties to try to help triangulate what a specific tissue is within the body. And so to kind of summarize, so the significance of T2 relaxation is that it's slow relaxation in water because there's very few spin-spin interactions, whereas it's intermediate or shorter relaxation in muscle where there's more spin-spin interactions that can occur. And so as a result, the same exact substance, so this is a pericardial cyst here that I'm imaging using two different imaging techniques. One is a technique where I'm waiting for T1 properties. Therefore, anything that has short T1 is going to have high signal. Anything that has long T1 is going to have low signal, versus if I do a T2 weighted acquisition technique, in which case tissues that have long T2 have high signal and tissues with short T2 have low signal, you can see that the water in the cyst can appear very different depending upon the type of pulse sequence that I utilize. And so the first thing, if I show you an image and say, what is this? First thing you want to know is what kind of technique is it that we're using? Because again, the same thing can appear very dark or it can appear very bright depending upon the specific technique that we utilize. Now, we've got about 15 minutes left. So next step is let's talk about how we're going to go and actually make an MRI image, okay? And the goal obviously is to make very high quality, attractive images. And MRI has the ability to do that as long as you know how to manipulate the scanner. So a few things that we're going to utilize. One is the first step is selecting the slice that we want to image. The second step is then doing what we call a phase encode. And then the third step is doing what we call a frequency encode. So again, if we have our patient inside the scanner, and remember I said that there's a gradient that's in the scanner as well, which alters the magnetic field, and it alters it in a graded fashion. That's why it's called a gradient. And there's actually 3 different sets of gradients that are available, that are present in all 3 dimensions to cover all 3 axes. And so the z-axis is what we typically refer to as the sliced direction, the slice selection gradient. So the net effect of this z, when I apply this z gradient, what I do is I cause the magnetization to go from 1.5 Tesla to be a little bit higher, in this case at the head, and to be a little bit lower, in this example, at the foot. So that the net magnetization is a little bit higher in the head, a little bit lower in the foot, and it's 1.5 Tesla right at the center. Now, what's the purpose of doing that? Well, remember as I said that the frequency that the protons spin at is based on this Gear magnetic ratio times the strength of the magnetic field, the local magnetic field. So areas that have a higher local magnetic field, the protons are going to spin a little bit faster than areas that have a lower magnetic field. And when I then go in to send in a radio frequency pulse, if you send in a pulse at a certain frequency so that only protons that are spinning at that frequency get excited. So in this example, at a 1.5 Tesla scanner, this right here, at the very isocenter as we call it, those protons are spinning at 64 megahertz. The protons up here are going to be spinning a little bit faster than 64 megahertz, and the ones down here a little bit less than 64 megahertz. And so depending upon where I want to image my slice, the scanner will send in an RF wave that corresponds to whatever slice location I told it to give. So let's say I wanted to image up here at the head, then it would send in maybe 64.5 megahertz. If I wanted to image more towards the feet, it would send in radio frequency waves at 63.5 megahertz. And these are just arbitrary examples that I'm giving you, which are obviously over amplifying the actual differences. But it gives you an idea. So the first step is to select the slice of interest. And then the last 2 steps are to do what we call a phase encode gradient, which you can think of as the y-axis, and a frequency encode gradient, which you can think of as the x-axis. And this allows you, based on this information, to actually localize where signal is coming from within now your imaging plane. Okay? And again, I don't want to get too much into the weeds because we don't have time for it. But let me skip forward here and then talk about the fact that once we send in the radio frequency waves and we've applied these gradients to alter what protons actually get excited in the body and which ones do not, there's actually signal that's emitted back. And the signal that's emitted back actually comes in the form of phase and frequency information. That information can then be plotted in what we call K-space, and then a mathematical transformation occurs that's called a Fourier transformation, which then allows you to actually go from this information about phase and frequency plot to generate an actual image. So we're not actually imaging a portion of an image, rather every line of K-space somehow contributes to the formation of the image in one way or the other. In fact, there is another principle to keep in mind, is that the center lines of K-space actually correspond to information about image intensity. So I could actually reconstruct an image only using the center lines of K-space. Or I could reconstruct an image only using the peripheral lines of K-space. And the peripheral K-space gives you information about the image details. So it gives you resolution, but it gives you no image intensity differences. So obviously an ideal image is one where you combine the peripheral data, which give you the details, as well as the center lines of data, which give you image intensity differences to then generate a full image. But the reality is you can generate an image with any part of the K-space acquisition that you did and get an image, but it won't necessarily be a complete image. But it's not complete in the sense that you're only getting the top half or the bottom half. Rather, it's incomplete in the sense that the amount of details or the amount of image intensity information in the image is not complete. Okay, so this obviously is a huge amount of stuff to kind of just give you an overview of. I want to try to bring this back down to earth now and talk about some more practical applications. And these are things that whether you're rotating in the MRI lab or you're up in the CCU or on the floors and you're thinking about ordering an MRI, you want to be aware of. And the first obviously is that when we talk about a magnetic field that's 20,000 times stronger than the Earth's magnetic field, it's actually a very powerful magnet. Okay, and that means that if you take a ferromagnetic object, it will start to get attracted to the magnet, and it accelerates as it gets closer because a magnetic field gets closer and closer as you get closer to the magnet, right? So as a result, this is an example of what can happen, what can go wrong. Is you could accidentally take a bed or an oxygen tank or something into the room that's magnetic, and you could cause a disaster. If a patient was lying on the board here, we'd have a major, major problem, right? And there's been reported cases of, patients undergoing imaging and they're getting short of breath and somebody says, let me go take an oxygen tank into the room, and that oxygen tank goes and flies and patients have died from this. So first thing I think to recognize is you can't take ferromagnetic objects into the room. Now, what do I mean by ferromagnetic? Those are objects that are attracted to a magnetic field. The second thing to keep in mind is that if you're not sure if it's ferromagnetic or not, it's best to not take it into the room until we test it out. So we have a local magnet outside that we can test anything to see if it is ferromagnetic or not. And the third thing is that the magnet is always on. So even when the lights are out and everybody's gone for the day, this magnet doesn't come down. The magnet always stays, if it's a 1.5 Tesla magnet, it always stays at 1.5 Tesla. So you don't want the cleaning crew coming in, you don't want your code team coming in to try to save the patient. The first thing you do, if there's a code inside the MRI scanner, is you get the patient out of the scanner, close the door, and then start doing CPR and your resuscitation. Okay, so those I think are basic important things that I think everyone needs to be aware of. Now, a few other things obviously is if you happen to have ferromagnetic objects on you, then you probably don't want to work in the MRI suite. You probably don't want to go inside of it. So you need to be aware that if you're rotating through the lab and if you happen to have a pacemaker or defibrillator, you don't want to be the one going inside the MRI scanner. The other thing also to be aware of is that those credit cards that we have, what do you think, how are those? They have a magnetic swipe on the back, right? Well, what do you think happens to that magnetic swipe when it goes into a magnetic field? It gets lost, right? So if you're getting an MRI or you're in the lab rotating and you go in with your wallet, you can be assured your credit cards are all going to get declined. You're not going to be able to buy anything that weekend. So again, make sure you leave your wallet outside the door unless you actually want to give up your credit cards for a few days. Was that?
Does it erase the debt with the...
Well, that's the problem, is the debt stays with it. Yes, it doesn't erase the debt. So you can ask Dr. Little. He was one of our first volunteers when we first started. And he went in and he volunteered nicely. And then he said, oh, yeah, that's good. It wasn't too bad. And then, that was Friday. And then Monday he came in. He's like, yeah, I went shopping with my wife and I couldn't buy anything. And he's like, he's just saved me a lot of money. So, yes, if you go in, don't take your wallet in the room. The other thing is that before any patient goes into the room, we have a careful screening form that we do to ensure that the patient doesn't have anything that's MRI unsafe. Okay? Because if they do, then we don't want to scan that person. All right, now the first step is knowing what they have. It doesn't mean every single thing is contraindicated. Even pacemakers and defibrillators now, we've got ways that we can do those, but we again have to make sure we know about it, and then we have to reprogram the device accordingly. Same thing, if a patient has shrapnel in their eyes, that shrapnel could move or dislodge in the MRI scanner, and you don't want to cause blindness to occur. So oftentimes if there's a patient who does welding or grinding or has any shrapnel history in their eyes, you want to get x-rays of the orbits. And so this is important, for the fellows. If you're in the hospital or you're in a clinic and you're ordering an MRI, if a patient has anything, get x-rays of the orbit so we can check to make sure that there's no metallic objects that are close to any vital structures. And again, every patient has to get a safety screening, and it has to be done for every single time they get scanned. So a patient gets scanned today, they come back tomorrow for additional imaging, we'll redo the safety form again. Because you don't know what could have happened between the time of the last scan and this time, and you don't want to take a chance. Let's see. So we talked about the welding and grinding, the need to get x-rays. Now the other thing, let's get past this here, and let's talk about the nomenclature. So the nomenclature now, in the old days there used to be this kind of saying, well, it's MRI safe or it's MRI unsafe. They've moved away from that, and now we've got this three-tiered nomenclature. One is called MRI unsafe, and this is basically something that's known to pose a hazard in the MRI environment. So this is something you cannot take into the MRI scanner. Okay? Now, very few things are considered MRI safe now, because MRI safe is something that poses no known hazard in any MRI environment at all. And so therefore, what would be something that's MRI safe would be like a Petri dish, right? Something that has no metallic components, or something that has no magnetic items within it at all. And most of the devices that we have now are what we call MRI conditional. So most medical devices are labeled with this terminology. And this is a very specific terminology, and what it means is that an item has been demonstrated to pose no known hazards in a specified MRI imaging environment with specified conditions of use. And then conditions that define the MRI environment include the static magnetic field strength, i.e. 1.5 Tesla, 3 Tesla, the spatial magnetic gradients, again the strength of the gradients, the radio frequency fields, as well as the SAR, or the specific absorption rate, which is the amount of energy that's deposited. So it's really a very specific set of conditions that are defined to say in these conditions this device can be safely imaged. So I'm going to take you to a little bit of a kind of an interesting story. So how many of you have been to Las Vegas? Nobody here? Okay, everybody was like staying quiet for a second there. Okay, so how many of you have seen the Vdara Hotel? Right, there's that new hotel in the city center the city center complex in the very center, right? Well, so this hotel, when it first came out, it's a beautiful hotel with tons and tons of glass, all right? But there was a problem. Can you guys hear this?
The new MGM hotel there called the Vdara has been found to contain an extra you definitely don't want. It turns out when the sun's rays hit that curved building, it creates a 15-foot wide hotspot on the ground that is so brutal it can burn hair and skin and even melt plastic. Some unlucky hotel guests have been sent running from the pool area after being caught in what hotel employees are calling the death ray, a burning sensation from above. The hotel is rushing to fix the problem.
Okay, so what was happening here is all these windows, and it was curved, right? Now, again, this is a billion-dollar building. You've got engineers, galore that I'm sure looked at all of this, but the problem is you can't possibly anticipate every possible scenario. And what was happening is that it was only for a few days within a year that the angulation of the sun, and it was actually within a couple hours of those days, the angulation of the sun was such with all of these curved mirrors or windows that all the light was reflecting, and it was going into this small little 10 by 15 foot area of the pool, causing basically heating to occur of any person that was sitting in that part of the pool. So again, it wouldn't happen 360 days out of the year, only a couple of days of the year. But again, this is one of those things where you can't possibly test for every possible permutation or combination that can occur. And so that's why we use the terminology MRI conditional and not MRI safe for devices. The thing that, and this is probably the one message I want the fellows to leave with, is that there's a website you can go to called MRIsafety.com. So if you go to that website, there's actually a thing on the left-hand side called the list. Click on that, and you can just type in the name of an object, Medtronic core valve or whatever, and it will tell you if the device is MRI unsafe, MRI conditional. Obviously, most medical devices have some metallic components, so they're not going to be labeled MRI safe. And it will also tell you the specific conditions. If it's conditional, it means it's safe or it's acceptable to do in a set of conditions. And it'll say at 1.5 Tesla or at 3 Tesla, and it may have other specific requirements as well to say, you know, for imaging outside the heart, outside the chest, you know, a variety of different conditions. But so it's important. If you ever have a patient who has got a device and you're not sure, you can always just go to this website and look it up and find out if this person can be done or not. Now, obviously, this is what we do in the MRI lab whenever a patient comes down, but certainly you could save everybody a lot of time, and you could save the patient a lot of hassle of coming down if you just check the device, and if it's listed as MRI unsafe, then obviously we can't do an MRI scan on that person. Okay? So that's all I've got. It's a kind of a whirlwind to go through in 30 minutes. But I think what we're going to do over the course of the rest of the year is really go through the different clinical applications where we use this MRI technology. And then if anybody's interested in more detailed information about MRI, we have our MRI imaging conference every Thursday at 9 o'clock in the Fondren Brown conference room, the 9th floor. And anybody's welcome to come to that as well. Okay? Any questions or comments?
How can you calculate the spatial resolution?
The spatial resolution of the image that you generate?
Yeah.
Well, so that's based on the number of pixels that you generate. You're talking about the spatial resolution of the image, right?
Yeah, but I mean, how does that relate to the case space then?
Oh, yeah. So the more lines of case space you acquire, the more details or the more resolution of an image you're going to be able to achieve. Right? So the greater the number of lines of case space. So for example, and I'll touch on this, I think, in a couple of weeks when we talk about cine imaging. Okay. And we'll talk about the fact that you could do a cine imaging with a quarter of the lines of data, a half of the lines of data, or all 100% of the lines of data. And you'll see that the pixel size is lower if you do less lines of data. So each line of data that you acquire allows you to get higher and higher spatial resolution. Yeah. So this will make more sense in a couple of weeks. Yep. Okay. Any other questions? Okay. Well, thank you all for your attention. I apologize for the delay.